Today, the president had this to say about problems with the Obamacare website during a speech in New Orleans.
I promise you, nobody's been more frustrated. I wanted to go in and fix it myself, but I don't write code.
Well, plenty of programmers do write code, and 3 of them have created their own website that addresses some of the most annoying problems with HealthCare.gov. John Blackstone takes a look.
In a San Francisco office shared with other tech startups, 3 guys in their 20s saw HealthCare.gov as a challenge. This was a weekend project for you.
Weekends and evenings, yeah.
With a few late nights, Ning Liang, George Kaligaropoulos, and Michael Wasser built the HealthSherpa.com. The week-old website solves one of the biggest problems with the government site.
They've got it completely backwards in terms of what people want up front.
What people want up front is...
They want prices. They want prices and benefits so that they can make the decision. So you come to our website, you put in your zip code. In this case, I put in a California zip code. You hit Find Plans, and you immediately see the exchange plans that are available for that zip code.
They have plenty of experience working at places like Twitter and Microsoft before setting out to build their own internet companies. But this project is a public service.
There was no thoughts of, well, how do we make money this in time? It's like, well, this is a problem that we know we can solve in a really short period of time, so let's just do it.
Using information buried in the government's own website, built by high-priced government contractors, they found a simpler way to present it to users.
Well, that's the great thing about having such a small team. You sit around a table, you say, okay, so how does this work? There's no, coordination meetings, there's no planning sessions. It's like, well, let's read the document and let's implement this.
And the features keep on coming. I looked at your website yesterday, and that tax subsidy section wasn't in there.
Yes, we added this last night.
That's supposed to be one of the more complicated parts of the HealthCare.gov, is working out what the subsidy will be.
The subsidy calculation is fairly complicated, but it wasn't too bad.
Now, you can't actually enroll on the Health Sherpa site, but they do provide contact information for companies offering the plans. Users who find a plan they like can go directly to the insurance company, Scott, without ever using HealthCare.gov.
John Blackstone. Thank you, John.